For some post-op bariatric patients, just one donut can ruin their entire afternoon. Imagine you've already had weight loss surgery. You're at work and you happen to see some donuts in the break room. You decide to just have one. After about 30 minutes, your heart starts racing. You're sweating. You suddenly need to find a bathroom. Your stomach's cramping. You feel shaky. You honestly think something is terribly wrong. That's why dumping syndrome scares so many people. So if this happens to you, I don't want you to think I'm being dramatic. You are not being dramatic. It feels awful. But here's the good news. Dumping syndrome is often preventable, and for many patients, it gets better over time once they learn which foods trigger it. And in this video today, I'm going to try to tell you what to avoid from the beginning, so hopefully you never have to experience this. Hi, I'm Grace, and I'm a physician assistant who has worked with bariatric patients for 20 years. Today, we're going to talk about what dumping syndrome is, why it happens, and how you can greatly lower your chances of it happening to you. And remember, this video is general education only. It is not personalized medical advice. What is dumping syndrome and why does it happen? Dumping syndrome happens when certain foods move too quickly from the stomach or gastric pouch into the small intestine. After bariatric surgery, especially gastric bypass, food leaves the small pouch and enters the intestine at a faster rate than it did before surgery. Dumping syndrome is generally considered quite rare after sleeve gastrectomy because the pylorus, the valve at the bottom of the stomach that helps regulate emptying, is still intact. But dumping syndrome-like symptoms can happen when sugary, high-fat, or high glycemic carbohydrates move quickly into the intestine. The body can react strongly. That reaction can cause stomach symptoms, bowel problems, and whole body symptoms. Now, I'm sure you're thinking, I don't want this to happen to me. What foods trigger dumping syndrome? The biggest triggers tend to be foods and drinks that are high in sugar, rapidly absorbed carbohydrates, or sometimes fried, high-fat, or greasy foods. Early after surgery, patients are still learning. Sometimes you don't know what your body will tolerate until it reacts. But dumping is one of those things when your new anatomy gives very fast feedback. Your body basically says, nope, we are not doing that again. Ask any post-op bariatric patient that experienced this. They'll agree. Don't! I'm quickly going to talk about the two types of dumping syndrome, early dumping and late dumping. Early dumping usually happens pretty soon after eating, often within about 30 to 60 minutes. These symptoms are usually more stomach and intestine related, but they can also affect the whole body. Early dumping patients may have the symptoms we discussed earlier: severe abdominal cramping and diarrhea, sweating, weakness, and rapid heartbeat. Late dumping usually happens later, often about 1 to 3 hours after eating. That one is more related to blood sugar changes. So after a high sugar meal or drink, the body may release a lot of insulin to bring the blood sugar down, and then it can drop quickly. That can cause early dumping symptoms in addition to trouble concentrating, feeling faint, or actually passing out. And that's why it's important to talk with your bariatric team if these symptoms are happening, because symptoms that feel like dumping can sometimes overlap with other problems. And late dumping, especially if it involves low blood sugar or fainting, obviously needs your team's guidance. Now, here's the part most patients wish someone had explained before surgery. This is what you've been waiting for: how to prevent dumping syndrome. This is where patients usually have the most control. Number one, obviously the main strategy is to avoid the foods and drinks most likely to trigger dumping. We've just discussed those. Number two, your meals need to be small in size. Think eating off a small salad or kid's plate instead of a dinner plate. Meals should focus on protein first. Protein helps us slow down the digestive process and keep blood sugar levels more even. Number four, add complex carbs, meaning appropriate vegetables or fiber-containing foods as your program allows, as these break down slowly and again, keep blood sugar more stable. Number five, avoid high-fat meals like fried foods and regular fat cheeses, especially if you've had the SADIS or SADS procedure. Most programs also recommend separating fluids from meals, meaning you don't drink within 30 minutes before or after a meal. This is because drinking with meals may move food through faster and increase the likelihood of dumping syndrome and making you feel uncomfortable. But of course, follow your own program's instructions on timing of fluids and meals. Also, when eating, think of the word slow eating speed. Put your fork on the table between bites to help slow your intake. Chew your food well. Eating larger pieces of food quickly can contribute to stomach upset and can lead to dumping syndrome. Eat only until you no longer feel hungry, not until you feel full. This prevents overeating. It takes 20 minutes for your brain to recognize you're full, so stopping just when you no longer feel hungry usually means you'll feel satisfied but not bloated after your meal. What if you thought you were being careful but still have an episode of dumping syndrome? First, remember, if symptoms are severe, unusual, persistent, or concerning, contact your bariatric team or seek urgent medical care. But if it feels like a typical dumping episode and your team has already educated you on what to expect and what to do, many patients stop eating, sit or lie down, and let the episode pass. Of course, do not drive if you feel lightheaded, weak, shaky, or feel like you might faint. And afterward, think about what may have triggered it. Ask yourself these questions. What did I eat? How much did I eat? Did it contain added sugar? Was it a high-fat or fried food? Did I drink with the meal? Did I eat too fast? This is where a food and symptom log can be helpful. And you don't need to track your foods like this forever. But if you're having repeated symptoms, writing down what you ate and when symptoms started can really help your dietitian or bariatric team identify the pattern and the triggering foods. The good news is that dumping often improves over time. Part of that may be the body adapting. It can also become a strong teacher. Patients may tell me, I tried that once and I will never do that again. But the goal is not to suffer through dumping over and over. The goal, obviously, is to prevent it. And most of the time, that comes down to education, meal structure, and regular follow-up with your bariatric team. If you found this helpful, subscribe for more clear bariatric surgery and medical weight loss education. If you want to see more in-depth videos about bariatric surgeries or just how to survive after surgery, click here or here. I hope these videos help you feel informed and confident when you discuss weight loss choices with your provider. I'm a physician assistant, but I'm not your PA. All medical decisions should be made by your healthcare team. Thanks for watching, and I'll see you in the next video.